Welcome to Shape of the City. I'm Clover Frederick and I'm your host. Now, some of you may have been seeing the fun new message that's going around town called 5-4-3-2-1-GO. Well, let's learn more about it. Today I have with me a couple of guests. I have Angelina Stovall-Amos from the Lincoln-Lancaster County Health Department and Nicole Weber, who's coordinator at Parks and Recreation's McPhee CLC. Thank you both for joining us. Now let's start with Angelina. Angelina, tell us a little bit about the 5-4-3-2-1-GO message and how it relates here in Lincoln.
Live Well Omaha Kids is the sponsor for the countdown message here in Lincoln, or in the state of Nebraska. Lincoln-Lancaster County Health Department is able to use the 5-4-3-2-1-GO message through the Maternal Child Health Grant funds, and the countdown message 5-4-3-2-1-GO originates from CLOC, which is the Consortium to Lower Obesity in Chicago Children. This message is a simple countdown message. It's goes over 5 simple actions for everybody to do every day, and it stands for 5 servings of fruits and vegetables, 4 servings of water, 3 servings of low-fat dairy, 2 hours or less of screen time, and 1 hour or more of physical activity.
Great, that sounds like a fairly simple message. So who is the message aimed at, and ultimately what are you trying to accomplish?
Well, we're targeting children ages 2 through 10 and their families to adopt this message into their household. With this message, it just describes those 5 simple actions, and ultimately what we're wanting is for the children to take each action of the 5-4-3-2-1-GO countdown message and adopt it one by one. We aren't trying to pressure families to do all of these changes at once because it's not practical to make such big changes. And honestly, the average, so if you take, for instance, like if you take the fruits and vegetables, 5 servings of fruits and vegetables a day, on average, according to our BRFSS surveys, the average person eats about 2.5 servings of fruits and vegetables a day. So if you reach 5 servings of fruits and vegetables a day, just work on that one goal, it would be a big accomplishment in itself to reach that. So what we're saying is take one of the actions, try it out for a while, see how it goes, and then adopt another action until doing all of these healthy behaviors becomes the simple choice and easy choice, and it's just something that you do every day.
Great, great. Now, tell us what sort of impact you've seen so far.
We have a lot of successes with our partners adopting this countdown message into their organization. For example, one of our partners, take for instance the city libraries. They have used this message. They started out simply by putting up the posters and using the bookmarks that we provide free to them. They just kind of create that healthy environment by having those posters displayed. And then they took it a little bit further by adding like these physical activity like balls and stacking blocks. So the children are using their whole body when they're moving. And then they also have like youth group clubs that they used to use for their food. They ordered like pizza and pop for their snacks. And now they have changed it over. They revamped their menu. They actually incorporated fruits and vegetables and like popcorn and pretzels, like lower calorie, higher nutrient dense foods. And it was funny because the kids of the youth group, they took the change fine. And it was the adults that had the little pushback before when they made those changes. So it's just funny, like if you provide these healthy options to kids, they'll take it. It's just when you don't have it and you don't create that sort of supportive environment, that's when you see the reverse health effects from not providing all of those.
So now tell me, who are some of your partners in the community?
Well, we have over 50 community partners in the Lancaster County. Some of these partners are doing great things. They include anywhere from like dance academies who focus on water when their kids are learning their routines, or the Malone Center, who is incorporating more fruits and vegetables and physical activity into their program. We also have grocery stores such as Hy-Vee and the B&R stores, which encompass the Russ's, Save Best, and Super Savers in Lincoln. And the rest is incorporating like grocery cart signs on as a trial basis in their store, and they're seeing great results, with an increase of fruit and vegetable purchases increasing. We also have other partners such as CLCs, recreation departments, just a lot of great community partners. Lincoln Public Schools is also using 54321GO as their nutrition promotion message for the school system.
Well, now let's talk a little bit about another one of your partners, the McPhee CLC. Now, Nicole, tell us a little bit about your organization and specifically what a CLC is.
I'm with Lincoln Parks and Recreation, and the building I'm located at is McPhee Elementary School with their CLC. And really our goals are working towards helping students create thriving families and strong neighborhoods. Utilizing the 54321 message. In our programs, we can utilize it at our family events that we have. We do a lot of club activities with our youth, and we can incorporate the message in those ways. So really our goal is just to create smart students, thriving families, and strong neighborhoods through the CLC.
Okay, and so you've already started incorporating this message. Tell us first what sort of challenges you faced.
You know what, kind of like Angelina said, our kids jumped on board right away. LPS does the healthy snacks throughout the school day. We utilize some healthy snacks in our clubs during the after school time. Therefore, we're getting milk on a daily basis and vegetables on a daily basis every other day throughout the course of the week. Some other ways that we've incorporated is through our after-school clubs. We really do a focus on nutritional clubs, recreation clubs. Another piece that Parks and Rec has done is take away that screen time during the before after-school programs as well as our summer day camps to kind of get kids away from the TV screens into our gyms, doing activities that they're up and active and engaged in.
Okay, very good. Have you seen a lot of resistance, or are they, really kind of embracing the message?
Our kiddos are doing a great job of really embracing the message. Again, utilizing the posters when they're at the drinking fountains, they're seeing it on a daily basis to see those messages. So it's not really that big of a change when we do celebrations and we incorporate fruits and vegetables as opposed to doing candy and those types of things.
Okay. Do you have a success story to share with us?
One piece that Parks and Rec is really working towards is getting youth up and moving. We've done some data collection, and we are seeing that because of taking away the screen times and really being intentional in our activities, that we're actually seeing a growth in our cardiovascular improvement with those students that we work with during those summer months from the school year. So those kiddos that are engaged in our activities during the summer, they're keeping up on those physical activities that they're no longer getting in gym class.
That's great. That's great. Well, let's talk a little bit about what's in store for the future for 54321GO.
Well, we've been working on getting the awareness out about 54321GO, having people see the message and know what it is, and also understanding what each of those actions are within 54321GO. What we're working on now is getting people to make those changes, to make it happen, adopt it, integrate it into their lifestyles, and do it. So by doing that, we are going to start a social media campaign here within the next few months. And with that, we're going to incorporate a little bit about Let's Move Lincoln, Nebraska, which is the mayor signed us up to be a Let's Move city with Michelle Obama, First Lady Michelle Obama's initiative for childhood obesity prevention. So we're kind of mixing it together. Let's Move is the national campaign, and 54321GO is our local campaign here. So by combining the two, I think we have a strong force. And within the social media, we're going to kind of bring out some challenges to the community for them to do, so they can, for instance, like one of them is going to be our healthy hydration challenge, where we're going to challenge the community to make their own naturally flavored water by adding fruits, vegetables, herbs, different things into the water to flavor it besides having those sugar sweetened beverages. And then they can just kind of see what it's like instead of just drinking plain water, which can be kind of monotonous as time goes by. Having like different flavors might encourage people to drink more water.
Now, if somebody in the community wanted to learn more about the message or perhaps incorporate the message in their own organization, how could they learn more?
Well, we invite any organization or even individual to join our group. We have monthly meetings where we gather together and we talk about the new things that we're doing, the successes that we're having, any barriers that we can brainstorm ways to get past with the use of 54321 Go in their organizations. If you do want to join, or if they do want to join, we invite them to go to our website. It's located on the Lincoln-Lancaster County Health Department's website under the Health Promotion and Chronic Disease tabs. You'll find it there.
Okay, very good. Well, the message seems very clear and definitely achievable, so I think we look forward to seeing that social media campaign coming. Now, when we return, we're going to hear about another initiative here in Lincoln that's also working to improve nutrition for youth.
Just as a reminder, the health insurance marketplace is open for enrollment November the 15th, 2014 through February 15th. Of 2015. If you are low income, you may get help purchasing insurance on the marketplace, or you may apply for Nebraska Medicaid at the same time. Thank you.
Welcome back. I'm Clover Frederick, your host for Shape of the City. Now, teaching your own children healthy eating habits and activities can be enough of a challenge, but when you send them off to childcare, you kind of wonder what's happening there. Today I have a couple of guests with me who are working on an initiative called NAP SACC. Now, I have with me Emily Hulse from Teach a Kid to Fish and Danny Martin from the Malone Center. Welcome, you guys.
Thank you.
Yeah. Now, Emily, tell us a little bit. Tell me what NAP SACC stands for, and then tell me about the Go NAP SACC program.
Okay. Well, NAP SACC stands for Nutrition and Physical Activity Self-Assessment for Childcare. NAP SACC started in North Carolina about 10 years ago, so it's been around for a while. It is a research evidence-based program. It helps childcare programs to kind of work through a process, and the process includes the key components of a self-assessment where they kind of look at what are their strengths and what are some areas they can work on when it comes to nutrition and physical activity at their program. And then it includes continuing education workshops and opportunities that includes skill building activities. And then through the self-assessment piece and those workshops, we identify some goals for those childcare programs based on the key areas that are included on the assessment. And then my job is to help those programs to meet their goals, to provide resources and things. So NAP SACC helps to kind of improve and promote a healthy environment when it comes to nutrition and physical activity. The key areas now include breastfeeding and infant feeding, child nutrition, the physical activity, and outdoor play and screen time. So those are the areas that are included on the assessments and that are involved when it comes to the training. And like I said, it is kind of a process that these child care programs go through and provides them with resources.
Okay, now tell me how it got started here in Lincoln.
Yeah, so Teach a Kid to Fish, like I said, the nonprofit organization that I work for, our mission is to prevent and reduce childhood obesity by helping kids and families to have the resources they need when it comes to healthy eating and activity. So we received state funding in 2011 to work with 5 child care centers to kind of pilot this. Like I said, this program was already developed and based on research and stuff, and other states can adapt it, but nobody in Lincoln had really used it with their child care centers. So we started, like I said, in 2011 and had great success with the 5 pilot child care centers that we worked with, so we wanted to continue to do that.
Okay, now what are the ultimate goals of the program?
So the ultimate goals, like I said earlier, since NAP SACC is kind of a process, and the child care program kind of chooses what goal areas are important to them, as well as guidance from myself as their NAP SACC trainer. We want to help the child care program to meet their goals. So everybody's goals are a little bit different, and there's different types of child care programs. So it is a little bit dependent on on each scenario, but yeah, we want to be able to provide the resources and training that they need. NAP SACC is unique, and there's not very many other opportunities for child care programs to get this sort of training or resources. So yeah, we are there to help them meet their chosen goal areas.
Okay, well, now that you've been doing this for a while, what would you say is the key to being successful if a child care provider would like to start this?
Yeah, I think it a lot of times comes down to the child care director or owner or manager, kind of that key lead person, and their staff. How motivated are they? How much time do they have to devote to NAP SACC? Do they have the support of the parents and the staff and the kids at their center? And that is a big key to being able to implement all of their chosen goal areas.
Okay, now where have you seen the most impact so far?
And I think that goes a little bit back to the question I was just answering, because yeah, a lot of times it is those sites that are really involved, that kind of take NAP SACC and run with it, that are able to make a lot of changes. We have been able, over the past 4 years, been able to work with about 40 child care centers in Lincoln, reaching around 300 staff and 3,000 children between those 40 sites. So we usually try to work with about 10 programs a year. So that's great, considering there's I think about 140 child care centers in the Lincoln area. So they've reached about a fourth of them. So we continue to.
If we have somebody who has a child care center that's watching, how would they learn more about incorporating this program?
Yeah, so they can learn more by going to, we have 2 different websites where it'd be helpful. They can go to the teachakidtofish.org website, which will be included at the end here, and contact us through that. And then we also have a Nebraska Go NAP SACC website, and that address will be included also, where they can go online and register a free account and get started by completing that self-assessment tool and everything. So.
Great. Well, now let's talk to Danny for a little bit. You're with the Malone Center. Tell us a little bit more about the Malone Center.
The Malone Center is a community center that serves the multicultural and low-income youth and elderly of the Lincoln community. We have several programs. The one I work most closely with is the after-school program, where we have kids from 5 or 6 different schools around the Malone area. We pick them up from their schools and bring them to the center, and we have nutrition programs and homework help and fitness activities for them to do while they're there, and then we take them back to take them home afterwards. And so yeah, it's just a great place for kids to be while they wait for their parents to get off of work.
Now, Danny, tell us how the Malone Center has incorporated Go NAP SACC.
Well, as the nutritionist and cook at the Malone Center with the after-school program, I was connected with Emily through the child and adult food program in Lincoln. They told me that we're doing really wonderful things with our program, and that thought we could use some of the resources that Go NAP SACC had. So Emily and I started with a self-assessment, just talking about the things that we're doing well and just areas that we can improve on. And then the next time she came back to the Malone Center, she had a couple carts full of boxes, full of wonderfully colorful resources. And actually, Emily has a couple here. One of my favorites is called The 2-Bite Club. Is a book just illustrating that if we haven't tried something, maybe we should try at least 2 bites of this new food and see if we like it, because our taste buds change. So that was a real hit, especially with the younger kids. And at the Malone Center, in conjunction with the after-school program during the summer, we have the kids there full days. And I had the kids read these storybooks with me, and then we were trying 2 bites of everything for breakfast and 2 bites of everything for lunch, and just now and then the kids are like, oh, I didn't know I liked tomatoes. So these resources really played a vital role.
Great. And now the resources were free to you, correct?
The resources were all free, yeah. They were all, as a nonprofit center, yeah, it's difficult to come by, especially colorful resources, and Emily provided all of these resources for free. And another one of my favorites that she provided us with was this Healthy Foods Cookbook, and it's just got dozens upon dozens of recipes for child care centers that actually tells you how much to put in for 50 kids. So it's a really helpful resource.
Now, Danny, tell us a success story that you're seeing at the Malone Center.
Well, with all of these resources, some of them work together really well. Emily provided us some gardening education books, and along with those and this wonderful Healthy Recipes book, I had a really great day with one of the kids where we ventured out into the garden with some of the reading materials, and we were talking about the plants. And that particular day, we were having for lunch we were having red lentil tomato soup, and that was from this book. And in the garden, we were picking basil for the soup, and as we were chopping up the basil, as I was chopping up the basil in the kitchen, and she was watching, we put it in the soup, and we tried it, and just the way her eyes lit up, it was just the most miraculous thing. Just the whole experience for her, from harvesting the basil in the garden to watching it get chopped up to tasting in the soup. It was just one of my favorite days at the Malone Center. So, and that just was completely to do with all these great resources and all of the great help that Emily has provided the Malone Center with. So that's one of my favorite stories.
Great. So you've had a lot of success. What have been some of the challenges with incorporating this into your organization?
I'd probably say just time management. Because Emily brought over so many resources, it was just a little difficult to make time to look through everything right away. So I think it's just child care centers that are interested in getting involved with the NAP SACC program just need to make sure they just take it day by day and don't get overwhelmed by the resources. There are many wonderful things to look through, and yeah. Just take your time. Okay, great. Well, I think the 2-bite idea is something I can definitely incorporate at home. Very good. Well, now, Emily, tell us what's in store for the future with NAP SACC.
Yeah, so the NAP SACC is a really important program to teach a kid to fish. Like I said, we've seen a lot of success with it, so we want to continue by having local and state funds, we can continue this program, and always looking for more funding to make it even more sustainable and expand our efforts here. So we continue to look for child care programs that are interested. NAP SACC is something that is optional, so it's not required that child programs do this, but it is encouraged, like he said, by people at the state staff with the Child and Adult Care Food Program. We have a lot of partnering organizations throughout the community and state that also help to support our NAP SACC efforts. And like Danny said, everything is free. Everything's free for the child care programs that participate. So the staff earn free in-service hours, and then they get free resources and free technical assistance to help meet their goals. So that is always an advantage for participating programs. Since it is free, then it is doable. And the participating sites we work with are able to earn free related incentives, so physical activity, props, and nutrition education materials and such. So. Okay, great. Well, now thank you both for coming on the show, and I appreciate all the great work you're doing in the community. Great, thank you, Clover. Yeah. Now, when we come back, we're going to hear more about healthy ways that we can incorporate nutrition in the new year.
My name is Nicole Seville. I'm the Wellness Manager here at Open Harvest, and today I'm here to tell you about some foods that can be used for seasonal health during the winter months. Let's begin with my favorites, the onion family. Onion, garlic, and leeks. All members of the onion family share key qualities. They are pungent and have an influence on the lungs. The pungency comes from the sulfur compounds, which are the therapeutically active ingredients, as well as the smelly ones. The sulfur compounds facilitate protein metabolism in the body, which can benefit those on a high-protein diet. This is particularly helpful this time of year as we move more toward a meat and potatoes diet and tend to include less leafy greens in our meals. In addition, sulfur promotes the elimination of toxins from the blood, lymph, and body. Onions have antimicrobial, antiviral, antiseptic, and purifying properties. They are excellent for clearing mucus and reducing inflammation of the nose and throat. The pungency has an affinity for the lungs, which makes onions excellent for bronchial inflammation and other chest congestion. The warming nature promotes circulation and can help reduce clotting and blood stagnancy. Garlic, the most pungent onion family member, also facilitates protein metabolism and toxin elimination while also stimulating the secretion of bile and promoting the growth of healthy intestinal flora. Due to its antimicrobial, antibacterial, antifungal, and antiviral properties, garlic is often referred to as the king of herbs. These properties make garlic appropriate for worms, parasites, the common cold, flu, dysentery, pneumonia, infections, and wounds. And if that wasn't enough, garlic is also well known for its ability to balance blood pressure and cholesterol levels. Leeks, like all onion family members, contain the sulfur compounds. However, as a much milder onion family member, leeks are not as potent, but still possess the same qualities as onion and garlic. Next, I'd like to talk about the benefits of peppers. Like the onion family, peppers offer digestive support through stimulation of gastric secretions and clearing of stagnant food when the digestion is slow. Cayenne peppers have antimicrobial properties, and all peppers are high in vitamin C, which make them more valuable than citrus for warding off the common cold. Cayenne's spicy nature acts as a decongestant and can increase the stomach fire to burn off pathogens. Cayenne also contains an ingredient known as capsaicin. Capsaicin depletes the neurotransmitter known as substance P from the nerve fibers. This depletion of substance P blocks the transmission of pain messages to the brain. In addition, hot peppers bring blood to an area for increased circulation and healing. Together, these properties can make cayenne tea effective for soothing and stimulating a sore throat. Potatoes offer digestive support by lubricating and calming the digestive system, as well as aiding in the reduction of bloating. These properties are said to harmonize the stomach. The rich potassium content of potatoes is excellent for balancing the metabolism of salt, which makes them especially good for those who consume high sodium foods. Additionally, an acidophilus culture is said to be present on the skin of potatoes, which can help establish beneficial intestinal flora. The juice of potatoes can be used to soothe stomach ulcers and reduce high blood pressure related to excess salt intake. Some of my favorite culinary herbs during cold and flu season are thyme and oregano. Thyme offers seasonal support through several avenues, being antiviral, antibacterial, antiseptic, antimicrobial, and antifungal. Thyme is perfect for the acute onset of colds, flu, and sinus and respiratory infections. Thyme also acts as a decongestant, expectorant, and mild astringent, which makes it especially helpful for mucus congestion and wet or damp coughs. In addition, thyme may be helpful for food sensitivities or food allergies, as it can balance an overactive immune system. Oregano, like thyme, has antiviral, antibacterial, and antifungal properties, as well as acting as a mucus-clearing expectorant. In addition, oregano is good for stimulating a beneficial fever. So when you're looking for seasonal support during the winter months, look no further than your kitchen or pantry. You'll likely find just what you need to get you through these cold, dreary months.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thank you for watching. Until next time, get active, eat healthy, and stay informed.
you.